My name is Kristin Bagley. I've been in practice as a family physician for 12 years, all of that with HRH. My first jobs were during college. I worked in medical labs doing undergraduate research in biochemistry. Prior to working, I was a hospital volunteer in my high school years, and I did that for several years. That's what kind of got me into medicine in the first place. When I was in high school, I started volunteering just to get opportunities and experiences that I hadn't had prior. For example, I worked at our local hospital as a candy striper, for lack of a better term, in the registration department and in the obstetrics department. Most of my jobs, entailed providing comfort to patients. So I might be delivering flowers or mail, but often I was just sitting there and listening to them tell stories or lending a hand when I was needed. It really allowed me to feel this sense of need. I didn't always feel that I was needed in other places, but as a volunteer, I could find places where they needed me. In my community now, I've continued volunteering. I've been a Girl Scout leader for 10 years with my daughter's troop. I've served in our local community as a Girl Scout coordinator and service leader. I volunteer at the Humane Society in Hancock County on a regular basis, along with other opportunities, food pantries, things like that when I have the time. I'm active as a volunteer at my church. And just allowing me to both experience being a volunteer, but also teaching volunteerism to my children, to my Girl Scouts, and helping them learn that their community is about everybody coming together. That's probably what I'm most passionate about. I don't always pride myself on things that I do, per se, but often it's about the ways that I feel like maybe I've helped other people around me achieve their best. So whether that's seeing pride in one of my Girl Scouts who's afraid of talking and all of a sudden gets out there and introduces herself for the first time and talks to a stranger, and I know that we worked on that so hard. So it's that mama bear proudness. It's seeing my patients struggle as teenagers and become healthy, productive adults who finish school, and they come back and they say, "You always believed in me." That's the things that makes me proud. I think often a physician thinks of themselves as a healer. I don't necessarily see myself as a healer. I see myself more as a mentor, as a guide in your health. So in order for you to have good health, you need to take part in that. But you often don't know how. So as a physician, I can help teach you the skills to take good care of yourself, encourage you to move forward in the ways that you need to get better, and be there to congratulate you when you reach that point. It's also sometimes about being there when you're struggling. It's about listening and saying, it's okay, we all have setbacks, and encouraging you to keep moving.